Dr. Bob here, and I'm going to try to do a good job introducing my Dr. Bob YouTube channel. And it's going to take a little while. I want you to get to know me a little bit so you can decide if you want to follow this channel. The point of the channel is going to be to teach people a lifestyle of health and wellness that I've learned through careful study, coming from the perspective of a disease model doctor with 27 years of emergency medicine experience and a health and wellness physician having studied that paradigm for the last 7 years with great intensity. And I guess I might as well start with why. Why would I be doing this? And to really cover that, I have to go back a little ways. You know, I started out in school, just a science major, loved biology, chemistry, physics, always kind of excelled in that kind of thinking, and allowed me to get into college and then subsequently, after being sort of dissuaded from becoming a fisheries biologist by professors, I entered into the medical school match and got interviews and ended up at a really great school, University of Texas Southwestern Medical School in Dallas. Typically ranked in the top 5 medical schools in the country, actually. And for a jock, I did pretty well. I graduated 21st out of 205 other students, so I'm right at the 10th percentile. And I went and did a good residency in emergency medicine. Methodist Hospital of Indianapolis. I think at the time it was the second busiest emergency department in the country. I want to say that we saw 81,000 patients my third year of residency through one set of doors. I got a heck of an education. And I must have, because I've managed to practice emergency medicine now for 27 years in the private sector. I estimate I've seen about 60,000 patients, and I've never talked to a lawyer. So I clearly understand the disease model. But while I've been practicing medicine, I've had a few major occurrences. One was as I was aging, I was 47 years old one day, and I'm at a time in my life where I'm starting to kind of get a little tired and run down, and I built a fishing lodge, and I'm a director of the EMS system. I got a lot of sticks in the fire, and I'm starting to not feel like I have the energy to do it all anymore. And I'm in the ER one day. First patient that I see, nurse brings me an EKG, shows the guy's having a heart attack. I rush over to see him. He's 47 years old, same age as me. I go through the quick risk factors. Heart disease, family history of heart trouble? No. Cigarette smoking? No. Diabetes? No. High blood pressure? No. Well, those are the big 4. A little bit overweight. At the time, so was I. No risk factors. How do I know he's not me? And the answer is, you don't, because we don't survey for disease. You see, in this country, we do not have a healthcare system. What we have is a disease care system. And it's a darn good one. I mean, we can save people from some incredible diseases. Our management of acute illness is phenomenal, best in the world. I have jerked people from the jaws of death over and over again in my emergency medicine career. And without the pharmaceutical industry, I couldn't do it. People come in having heart attacks. I can give them a drug that opens the artery up and saves heart muscle, and maybe they end up with no damage. Obviously, surgeons save lives all the time from trauma. Antibiotics kill infections that would otherwise kill us. I mean, medicine has its place, but we completely neglect our role in chronic disease. And there, the medical model seems to have a lot of corruption. I see the profit motive driving what we do as physicians instead of the patient outcome. So, shortly after having the revelation that maybe I could have chronic disease and not know it, I saw the Synergenics commercial. And I ended up ultimately doing their training in age management medicine. And what I learned enlightened me to things I just was never taught as a doctor in med school or residency. And I really learned how to take care of myself, and I had miraculous results. I followed their program fairly intently, and within 3 months, I went from overweight, no energy, not anywhere near as robust and happy as I am right now, to ideal body weight, more muscular than I'd been in decades, happy, feeling like I had all the energy in the world and life was no longer this huge, burdensome monster. And so what I'm going to do is I'm going to share with you everything I know and learned from having done that fellowship and now practicing this type of medicine for 7 years. I built my own office just to be able to provide this kind of care to people. I still practice emergency medicine, so I've still got my finger on the pulse of disease. And I'm going to share a lot of anecdotes and a lot of thoughts about things that I see in the disease model process from time to time. I'm going to be critical of it. I'll give it compliments where it deserves them. I'm going to cover everything. I'm going to cover my lecture series. I'm going to do things like these recent coronavirus videos that I've done. When new research comes out, I'll jump in and give that to you if I think it's impactful and you ought to know right away. But over time, I'm going to cover my lecture series. So I have a fishing lodge and I do wellness weeks at the fishing lodge where people come spend a week. I put them through a huge, elaborate exam and learn all this stuff about them. And then I teach them about themselves and how they can mitigate their risks of chronic disease. And during that week, each night I do a lecture. And I have 5 lectures that I do. I do it over a dinner, a healthy paleo-style dinner. And lecture 1 is chronic disease. Lecture 2 is nutrition. Lecture 3 is exercise. Lecture 4 is hormone replacement. And then the final lecture is supplements. And briefly on chronic disease, first, I'm going to teach you what we understand is going on at the molecular level. We're unraveling this thing, okay? And I'll make you understand how your behavior, combined with your genetics, leads to all these diagnoses that I treat in the ER all the time. Type 2 diabetes, high blood pressure, coronary artery disease or blockages in the blood vessels, stroke, congestive heart failure. I'll explain to you what sleep apnea is. I'll help you understand disease probably in a way that you don't currently understand it. Because if you don't know the enemy, you can't fight it. You have to understand what you're trying to prevent. And if I can convince you that most of what you're trying to prevent is going to be your fault if you get it, and I can teach you how to not get it, then I'm winning the battle. And that's my goal with this station, with this channel. I'm going to get to nutrition, and I spent a lot of time on nutrition. I read a lot. I think I've come up with a good plan. I'll quote the literature that explains how I arrived at my conclusions, my observations, my general compilation of what I think a good nutrition plan is. And I hope that seeing the data helps motivate you to follow my advice as much as possible, because by far, the hole in your face is the single most actionable aspect of preventing chronic disease. It's the most modifiable risk factor that you have in your life. And guess what the next one is? Mom told you this, diet and exercise, right? But nobody really tells you how to do exercise. And we have studied the science to where we can prescribe a efficient, brief daily exercise regimen that has tremendous benefit, and I'll show you the science that proves it. And then we have to talk about hormones. And of course, the big ones are the sex hormones, which decline as we age. And I'll explain to you the rationale for why it makes sense to get your hormones back to a youthful level, and the biological plausibility that that is in fact going to help you live longer. And I'll debunk the disease model naysayers. I promise you I can do this and convince you. And I'm going to support it with the science, okay? So I'm not going to make this stuff up. And then eventually I'll get to supplements. And when we cover supplements, we will talk about the big three that I don't need to see you to know you need to be taking them. Vitamin D3 with K2, a high quality probiotic, and highly concentrated, molecularly distilled, high quality fish oil. And I'll get into why those are my big three and what the physiology is behind them and how they help you. And then we'll go into some near no-brainers, and then I'll cover some of the subtle ones that are more typically based on a person's individual needs analysis. But I'll try to do a good job covering most of the big, well-known, sensible supplements, because it turns out supplements can help you. The disease model docs will tell you the studies say people who take vitamins don't live longer. And there's lots of reasons why that's true. Number one, the studies are garbage. They ask questions like, do you take a multivitamin? And then they follow people over time with no quality control on whether they took a decent multivitamin or not. And they're looking for a tiny effect, and it's just not a well-designed enough study. And they say there's no statistical difference in how long people take vitamins live. And vitamins are probably the weakest of the supplements in terms of really having much of an effect, other than maybe hedging the bets on a day when your nutrition's not that good. But some of the other supplements clearly have double-blind scientific evidence that they affect significant disease risk markers in a positive way, and the biological plausibility is that if they affect those disease risk markers in a positive way, collectively, if you're doing a lot of those things, it's probably actually going to have a benefit on your health outcome. So anyways, I guess that covers most of what I'm going to do here with the channel. Sorry if it took a while for me to describe it, but I want you to know what you're in for if you give it a shot. I'm going to start with chronic disease here pretty soon, and I'll still talk a little bit about this COVID-19 from time to time, since it's foremost in all of our minds. God bless you guys.